Another new technology, or relatively new technology, that we've been using for a couple of years now is guided implant surgery. I've been involved with dental implants for literally 30 years now, and I remember back in the old days where we didn't have the X-ray options that we have available to us now, and we were almost guessing sometimes when we were doing implant surgery. Nowadays, we can so precisely plan an implant surgery that it almost surprises me. But we can use a three-dimensional CBCT X-ray that actually shows the height, the width, and the three-dimensional volume of bone. And on that three-dimensional X-ray, we have about 4 different computer software programs that let us analyze what's available and actually plan the dental implant placement on the computer screen surgically, and then the guided procedures let us transfer that planning to a surgical stent, which we can place in the patient's mouth at the time of surgery, and it literally positions and guides the angulation of the burr and the depth of the burr to within about 0.15 millimeters to 0.2 millimeters, which is literally about the thickness of 2 sheets of paper. And this gives us several advantages when we're dealing with putting implants in tight spaces, when we're dealing with putting implants in under specific anatomical landmarks like the lower nerve or the sinus in the upper jaw. We can not only measure precisely with a three-dimensional CBCT scan, but we can plan the computer surgery, and then we can, most importantly, execute that with such a high level of precision that we wouldn't be able to obtain if we were free-handing it. The other benefit it gives us is oftentimes we can do the implant surgery through that special stent without making an incision in the jaw. And that dramatically reduces the trauma that a patient goes through in having implant surgery. We use a little burr, it almost looks like a cookie cutter, and it takes a tiny little disc of gum out instead of making a broad incision that's going to require a lot of sutures, and it's going to take a lot longer to heal. We do it with that level of precision, our predictability is better, and the experience that patients have is so much more improved over the older techniques.